Today, I'm proud to celebrate how far this work has come and where it's going next. I really thank you all for being here to mark this milestone that belongs to our whole community. As I did 2 years ago, when we marked the start of operations for DCC, I'd like to acknowledge those who helped us envision the path. As Commissioner O'Leary said, the Northampton Policing Review Commission called for the creation of a Department of Community Care, and importantly, for situating it within the public health framework. As they wrote in their report, quote, given the nature of the responsibilities we are recommending this department take on, and the recognition of racism itself as a health crisis, we advocate that the department be situated underneath the health department. This will give the department leadership and access to highly trained professionals who have experience with some of the most vulnerable in Northampton while simultaneously serving the majority of the population as well, end quote. That insight helped shape everything that followed. So I want to thank the commissioners, Elizabeth Baraha Roman, Booker Bush, Daniel Kennedy, Nick Fleischer, David Hoos, Alex Jarrett, Javier Luengo Garrido, Carol Owen, Namdi Pol, Michael Quinlan, Josie Rosales, and Cynthia Swopis for their work on that commission. Your work set a clear direction. Build a civilian care-first response and put it in the health domain so that it can reach people earlier and coordinate across services. That's exactly what Northampton did. With great thanks to the City Council for their work and for supporting the vision, we placed the DCC in what became our Department of Health and Human Services, institutionalizing a trauma-informed option that collaborates with all first responders, providers, and community partners. It's a model rooted in the simple idea that many calls for help are fundamentally health and human service issues, and they should be addressed that way. And boy, was the NPRC also right about the leadership and the trained professionals in the health department. I am deeply, deeply grateful to DHHS Commissioner Meredith O'Leary and Deputy Commissioner Michelle Farry for accepting this challenge and the innovation of establishing the DCC as a distinct response, separate from public safety, with the vision, and I'm going to use the word you used, grit, needed for defining its role in the city and for training responders for success in a brand new field. DHHS has accomplished this while also leading Northampton's public health response on many, many other fronts. And of course, as Commissioner O'Leary mentioned, now with the challenge of this unwelcome era of devaluing and dismantling public health support and information by the federal administration. As Meredith often says, as a team, they are scrappy. But I will also add dedicated, brilliant, resourceful, and deeply compassionate. I also want to give great thanks to Donovan Gibbs, the director. Thank you, Don, for guiding the responders and for building a culture of care that the city now relies on every day. And thank you to the DCC team for the quiet, life-changing work that you do daily. De-escalating crises, connecting people to shelter, treatment, food, and stability. Meeting people often on their hardest days and working daily with them to build trust and connection, which has been so missing in their lives. Thank you for all of that work that you do for our community. I also want to recognize our public safety departments, the Northampton Police Department, Northampton Fire Rescue, and Emergency Dispatched. Thank you for your openness and your partnership with DHHS and DCC. It is not every community and not every public safety leader who would be willing to learn about alternative response, spend hours and hours over years meeting about it, problem solving, and working to incorporate DCC not just into our options, but to truly strategize on how to work together to ensure that a call for help is met with the best, most supportive response for an individual. So thank you to Chief Cartledge, Chief Peelis, Director Schutze, and their departments, many of them are here today, for your partnership in this work. And we all owe great thanks to our state delegation, Senator Joe Comerford and Representative Lindsay Sabadosa, for their steadfast advocacy and support. We could not do this without them. Their leadership has been critical in securing resources for the DCC and for pressing for long-term state funding to sustain this work as a recurring budget line item, recognizing its success and importance to a comprehensive public safety approach for Northampton, and I think we all hope throughout the Commonwealth someday. So thank you for all of your support and your help. So today we celebrate that Northampton now has a clear, trusted place to call for situations like mental health crises, substance use concerns, housing instability, and checks on welfare. City departments, social service partners, downtown businesses, the judicial branch, and local medical professionals all agree. The DCC is compassionate and it is effective. Because it works, we have extended hours into evenings and weekends and strengthened the team to meet more of the demand. Across the country, cities are testing alternatives. Northampton's approach is different. It's fully embedded in municipal public health. It's built as a standalone civilian response with its own training and trainings and standard, and it's designed to collaborate, but is not embedded in public safety. It's also been designed for durability and flexibility, and its hours and its staffing and its data match the needs we see in Northampton. And this altogether is a combination that is unique to DCC, and it is working here. Celebrating the work we have done and looking ahead, I will continue to make a strong case to our state and our federal leaders. Northampton's model should be the standard for local response for unmet challenges for certain crises. When cities treat behavioral health, substance use, and houselessness as public health questions and build a civilian response capable of addressing them, communities get safer, faster, and they get more compassionate outcomes. So 2 years in, the work is proving itself. Thank you so much, everyone who has made this incredibly critical now part of Northampton a working success for these 2 years. Thank you. And we have a of Community Care second anniversary day here in the city of Northampton, September 26, 2025. Whereas 2 years ago, the city of Northampton launched the Division of Community Care, DCC, following research and recommendations by the Northampton Policing Review Commission, and years of community engagement and program building with the goal of providing an unarmed response for people in crisis. And whereas the DCC has supported 1,669 unique individuals through 13,319 total engagements, received 1,948 phone calls, 11,035 visits to the community space, 2,655 connections to resources and navigation services, and 1,047 times the DCC has provided housing and shelter navigation support. And whereas the inclusion of the Division of Community Care has become a central and invaluable part of the Department of Health and Human Services and City of Northampton response, and whereas the Division of Community Care has become a trusted place to visit and to call for assistance with mental health crises, substance use concerns, housing instability, welfare checks, and other public health challenges, extending its hours and staffing to meet community needs. So now, therefore, I, Mayor Gina-Louise Sciarra, do hereby proclaim September 26, 2025 as Division of Community Care second anniversary day in the city of Northampton. And on this day, we recognize and we celebrate the work of the DCC and all that they've completed these 2 years in their dedicated service to our community and for embodying our commitment to public health, safety, and community care, and hereby recognize it as a critical component of our city's emergency response. So in witness whereof, I have set my hand and imprinted the seal of the city of Northampton on this 26th day of September, 2025. Thank you.